All right, so this is going to be part 1 of chapter 11 in your pharmacy practice for technicians book, hospital pharmacy dispensing. So your hospital organization and function. So the functions within a hospital. Hospitals are there and can provide diagnosis and testing, treatment and therapies, patient processing, public health and wellness, preventative health initiatives, training of healthcare professionals, and conducting research. So hospitals are classified by certain characteristics. One is bed capacity. 2, the targeted population. So is it a children's hospital? Is it a veterans hospital? The type of service, affiliation, ownership of the facility, urban versus rural, and then financial status, meaning for-profit or non-for-profit. So on slide 8, it shows you what a sample organization chart of a hospital could look like. Again, it's very different, but it goes through, shows you there's a board of directors, which oversees the CEO. The CEO oversees either a vice president of patient care and a vice president of nursing, and then underneath that, all of the different departments will fall. Again, it's not exclusive. There's different hierarchies and different organizational charts for every facility, and each one is unique. So common hospital departments and their acronyms, so you have ambulatory patient care, emergency room or department, intensive care, labor and delivery, the neonatal intensive care unit, operating room and transitional care unit. So on slide 9, you can see the different acronyms that those are usually referred to as. So it's important, especially if you plan on going into a hospital setting, to kind of learn what those are. So when someone says you need to deliver this to L&D, you know that that's labor and delivery, or if it needs to be delivered to ICU, you know that's the intensive care unit. So it's important to know what those acronyms are. Your Pharmacy and Therapeutics Committee, known as the P&T committee, they review, approve, and revise the hospital's drug formulary. So just like insurance companies, hospitals also have their own drug formulary that they use. It is not conducive for a hospital to carry every single drug on the market. So the P&T committee is tasked with developing the drug formulary or the list of drugs that the hospital is going to carry. They also maintain hospital drug use policies, so why certain drugs are used for certain things. They review studies on the appropriate use of drugs within the hospital. They review investigational drugs for hospital use. So not every hospital will accept investigational drug trials. Most of those are the teaching hospitals. So for example, UMC or Banner would be one facility that does deal with investigational drugs. The P&T committee also monitors medication error reports. So as a result of that, there are tasked with monitoring any medication errors that happen within the facility, and that is part of maintaining the accreditation from Joint Commission. The representatives of the P&T committee can be hospital staff, hospital and nursing administration. The director of pharmacy is usually involved in that. The director of pharmacy is typically tasked with recording and disseminating the meetings from the meeting minutes. Drug information pharmacists can also be referred to as a clinical pharmacist. They are the ones that are researching and making objective drug formulary recommendations. And then there's also a pharmacy technician or more. And typically that pharmacy technician that is involved in the P&T committee is actually the purchaser, or the one that is tasked with buying and replenishing all of the stock for the pharmacy. So they collect data and perform audits for the drug information pharmacist or the clinical pharmacist. It's also important to have the purchaser for the pharmacy there because they're in the front line. They know if things are back ordered. They know if things are on shortage. They know what's been drug recalled. So that helps to develop what's available for the hospital to put on their drug formulary. The drug formulary is a list of approved drugs for the use within the hospital. It provides the most effective medication while also limiting the costs. To add a medication to the formulary, a physician must submit a medication application form. So let's say that there's a particular drug that one of the doctors really likes to use for whatever reason, and it's not on the drug formulary for the facility. They can submit a application form to get it added to the formulary. They're going to have to present why and all of those things to get it added. The drug information pharmacist or the clinical pharmacist will review literature. They will compare costs, the advantages and disadvantages to the existing formula. So a lot of times this formula changes very consistently depending on the cost of the drugs, new information that's out on certain drugs. So for example, Zantac, they've had to remove that from their drug formulary if they had it on there. And so what is going to replace that? Approval sometimes is restricted to a specific medical service. So let's say one particular drug that they are going to approve on the formulary is specific to only one type of medical service that it can be used for. It can't be used for other things. If a physician writes for a non-formulary drug, they may need to justify the use with the P&T committee. So typically the pharmacist will send back orders to any physicians that are writing for non-formulary drugs to find out why and get them on board to prescribe the drugs that are on the approved formulary. Medication error report. So the drug information pharmacist or the clinical pharmacist will collect and analyze the reports from pharmacy, nursing, and medicine. So any report of a medication error within the pharmacy, the nursing department, or the doctors are collected by the clinical or drug information pharmacist. The adverse drug events are then tabulated. They will identify and correct the system's problem to prevent recurrence. So that's part of the reason why they do the tracking. So they're going to look at everything that happened in that medication error from beginning to end and find out where the breakdown in the system was, get it changed to prevent that particular error from happening again. And again, this is something that is required to maintain the hospital's accreditation through Joint Commission. The Institutional Review Board, known as the IRB. This is a board that reviews the use of investigational drugs or procedures within the hospital. An investigational drug is used in clinical trials and it has not been approved by the FDA. Representatives from medicine, pharmacy, nursing, hospital administration, and members of the public are part of this Institutional Review Board. The clinical research study, it requires an IRB approval before it can even begin. The investigator submits the application in informed consent. The informed consent is actually a document that is written in understandable language about the study for participants that are going to be participating in the clinical trial. The IRB protects patients by ensuring adequate knowledge of the study risks and confidentiality of their medical information. The IRB collects information on adverse reactions to investigational medications and evaluates whether the studies with severe reactions should even continue. So the hospital pharmacy department, so services, so administrative services include, the drug formulary, the budget, inventory. That's going to be your hierarchy, your director of pharmacy, and any of your pharmacy managers. Distribution, filling prescriptions, delivering medication to the nursing units. Clinical, pharmacist only, consulting with prescribers and or patients. Educational, training pharmacists. Training patients, training the public or any other healthcare personnel, any aspect of pharmacy. Specialty services may include satellite pharmacies that are located in patient care units, clinical pharmacists making rounds with the physicians, or a drug information center. So a lot of times pharmacists will be assigned to certain floors, and they actually round every morning or every evening with the physicians, and that adds an extra benefit to quality of care and patient safety for our patients. So the location and structure of the pharmacy department. So designated areas such as a unit dose cart fill, repackaging, narcotic storage, investigational drug storage, and the preparation of sterile products. Pharmacies in a hospital are staffed 24 hours a day, 7 days a week, no holidays off. So that's something you have to consider if you're wanting to work in a hospital. The director of pharmacy's responsibilities. So this is the pharmacist in charge, and they oversee the day-to-day operations of the pharmacy. They determine the level and scope of pharmacy services that are provided within the facility. They plan and monitor the budget. They make staffing decisions, and then they help develop the policy and procedure manual that is specific to pharmacy department. So on slide 18, if you look on here of the major pharmacist responsibilities, so that encompasses everything that the pharmacy technician is not allowed to do. These are pharmacist specific responsibilities. So specializing pharmacists, what we call clinical pharmacists, that will go on rounds with doctors and nurses. In larger hospitals, the specialist pharmacists can be found in the different departments. So they'll typically have an office on a unit or in a particular department, such as the emergency room or maybe the NICU, the neonatal intensive care unit. And again, some pharmacists can have specialties, which can include compounding, chemotherapy, or IV medications. Again, it all depends on the size of the facility and the scope of services that are being provided to the community. So the hospital pharmacy technician, so your responsibilities are going to be significantly different than in a retail. So some will be similar and some will be different. So the responsibilities include preparing, packaging, and delivering the drugs to the units in the hospital. So in this case, we're actually delivering the drugs to the nurses, right? The nursing unit, the nurses, they're the ones administering the drugs to the patient. Stocking various dispensing units, including emergency crash carts. In the hospital that I worked in Albuquerque, we stored all of the crash carts down in the pharmacy. We replenished those. When a code blue was called, a technician and a pharmacist always responded, and we had to bring a new cart up to replace the one that had been broken open to use on the patient that was currently in cardiac arrest. And then as a pharmacy technician, just like with all staff in both retail and hospital, we're in charge of maintaining and monitoring the inventory. So work environment, you're going to have minimal interactions with patients. There's no processing of insurance claims. That's one of the reasons why I went into hospital. I didn't particularly like insurance, and I really liked the dynamic and the consistent learning that I was able to do in a hospital setting. You will typically wear scrubs of a specific color. The hospital I worked at, we didn't have a specific color, but for example, at TMC, their pharmacy department, they all wear black scrubs. And then you're going to have a name badge to identify who you are and what your role is within the facility. You must follow hygiene and infection control procedures, so hand washing anytime you're entering and exiting a patient room for whatever reason, sterile donning and garbing when you're preparing sterile products, and then the requirement of making sure you have a hepatitis B vaccine, and then they strongly encourage a influenza or flu vaccine every year. Some facilities will allow you to decline a flu vaccine, but they're going to require you to wear a mask typically from October to March during the flu season anytime you're on shift. Additional garb and hygiene for IV preparation in the clean room. So your training and orientation. So typically you start with an orientation which orients you to the facility that has hired you. You're going to be required to have additional training on the job and then regular training after that. You're going to be trained to perform all major department functions. And the reason why you're trained in all areas is to help with staffing. Most do not rotate through the clean room or hazardous compounding without specialized training. So I know at TMC you have to be a technician 2, which requires at least a year of hospital experience without preparing sterile products before they're going to allow you to move into the IV room. But every facility is different. Technician advancements and specialization. So you can specialize in things like medication reconciliation, sterile compounding, which you're going to do in this program. You'll get a certificate for that. Inventory maintenance, training of other staff. In Tech programs or TCT programs, the technicians can check other technicians' work. which adds an additional layer of medication safety. However, Arizona is not a tech check tech state. We do not allow tech check tech, okay? So electronic hospital records and medication orders. So electronic health records, known as EHRs, allow for easier communication about a patient within a hospital or a health system. So let's say Banner. You have a patient that is seen by a Banner primary care physician. They are put into the hospital at Banner for some reason. Banner Hospital has access to their electronic health records no matter where that patient was seen within the Banner system, which allows them to have the immediate access to their records. It helps improve documentation, and it provides an enhanced coordination of the patient care. Basically, the whole entire patient care is available to the hospital to see what they've been going through, what they're on, who's been taking care of them, and things like that, which provides overall increase in not only quality of care provided to the patients, but also safety. So intake records. Upon admission to the hospital, the patient will be interviewed about his or her medication history by the admitting staff or nurse. Some pharmacy technicians can specialize to identifying unknown medications brought from home. So if you have been part of a class where I had you do the IdentiDrug, excuse me, and you had to look up what the drug was based off of what it looked like and the markings on the drug, this is one thing that happens. A lot of times we have homeless populations, we have elderly populations that are brought in with just bags and bags of drugs. They're all mixed up, they're not in the correct bottles, and we have to be able to identify what those are. The patient is then given a wristband. There is a barcode on the band that is scanned prior to each medication administration to ensure that the medication that is being given to the patient is correct. So it's a barcode. If you've been in the hospital any time within the last couple of years, you know that you have a wristband with a barcode. They scan it, they scan the med. So if something's wrong, let's say the nurse pulled the wrong medication, it will alert the nurse that it is incorrect, or maybe it's the incorrect patient, okay? Medication orders. So these are ordered by the prescriber or the physician for a patient. They are received electronically, either by fax, or they're received electronically, like through the CPOE system, by fax, pneumatic tube, phone, or hand delivered. It's then written into the medical chart. But again, most things are now completely electronic. So with the CPOE system, pharmacists are no longer having to actually order entry. They're just verifying what the physician has put into the system. So types of medication orders. You have an admitting order, which is orders written upon admission. These include suspected diagnoses, orders for labs, diet, nursing, particular medications, and then a notation of drug allergies. A stat order is an emergency order that is typically called or sent in electronically, and it must receive priority attention. If you're ever handed an order from a pharmacist that is told, and you are told it is a stat order, you are to stop what you're doing and do that immediately. A daily order is a new medication order written daily by a physician after every patient examination, so after the doctor does their rounds. A continuation order. These orders are written when a patient is transferred from one unit to another, or when the physician reviews and rewrites all of the orders periodically. So let's say the patient was initially in the ICU and they're being moved to the step-down unit. The physician can write continuation orders to continue the orders that were being given in the ICU to be continued in the step-down unit. Let's say the patient has been in the hospital for 2 months now. The physician can continue to write continuation orders instead of having to rewrite all of those orders every time that they expire. A standing order, so in certain cases, the same medication and treatments apply for each patient receiving the same surgery or procedure. So for example, in our facility that I worked in, any patient coming in for surgery had a standing order for cefazolin. This is an antibiotic that was ran on the patient prior to surgery to help in prophylaxis of developing an infection after the surgery. That's a standing, that's a standing order. It's consistent all the way across. Every patient coming in for surgery got cefazolin unless they're allergic to the drug. Discharge order is an order that provides take-home instructions for the patient who is being discharged from the hospital. So we are ending on slide 26, and that is end of part 1.